Meanwhile, the latest UNICEF Poll U-Report published in October 2022 showed that about 73% of youth needed mental health services and support over the past year. This was an increase from about 10% from 2021. These statistics show that open conversations about mental well-being among children and young people can reduce stigma and points to a need for a holistic mental health response. How should the country work at decreasing these alarming numbers in the new year? Now, UNICEF South Africa's Chief of Communications, Toby tells us more about these findings. Toby, thank you so much for joining us this morning, and a Happy New Year to you. Now, how young are these people or these children that are seeking mental health assistance?
Yeah, no, Happy New Year to you too, and to all the viewers. So the poll, the U-Report poll, the age range who respond to that are between sort of 15 to 24 is the main age range. So you're looking at adolescents. You're looking at young people who are often in a transitional period of their life. And often at that point, there are more stresses when you're looking forward to employment, to matric, and other issues that come up around that time. So the U-Report poll really focuses more on 15 to 24-year-olds. And that was where around 73% said they felt they needed some support for their mental health.
The report also revealed that about 38% are actively seeking help. What sort of problems top the list in terms of what's troubling these young people?
Yeah, that's right. So what we saw this year, which was a slight change from a similar poll that was done the year before, was that issues like skills, so training skills, employment opportunities, and education more broadly came up as some of the main issues that people felt were really affecting their mental well-being. And the year before, there was a little bit more of a focus maybe on issues such as violence in communities. So what we're seeing is really people maybe from COVID were starting to look forward again, to look forward to what are they going to do next? How are they going to find work opportunities? How are they going to find the right and relevant skills to then go into the workforce? So that really came out as one sort of highlight from the poll in 2022.
So just in general, does South Africa have a culture of seeking help when it comes to mental health issues?
I think what we saw with this poll, which was very interesting, was we had 67% of young people said that they helped a friend in some way with their mental well-being. And that referred a lot to people who connected with a friend about their mental health. So that suggests that maybe the conversation is opening up more, there's more discussion, there's less stigma to a degree, though it still exists, about mental health issues. And that in itself is a positive in that people can feel like they can talk more. And also some of the young people and children said they could talk more with their family. And that was very important, that space was maybe opening a little bit more, because that can really do a lot to help one's mental health. You don't necessarily need to seek sort of professional support. So that was a very interesting findings and very important for the discussion in South Africa around with children and young people about their well-being more broadly.
And then for those that then don't seek help, do we know what often happens to those young people? Where do their lives end up in them not being able to speak to a friend or even seeking professional help?
Yeah, and that is obviously a massive concern for children and young people who don't get the help they feel like they need. And they're the children and youth are the most vulnerable who can fall through the cracks. And that's where we really need to maybe scale up that access to communication. For example, UNICEF also works with safe parks in communities where children and young people can seek help from social workers and from others, and really getting at what we call that sort of early intervention. So identifying the risk factors. And it also crosses over into the school community. So how can teachers, play a role to better maybe identify children who have mental health issues and refer them to relevant services. So it's a lot of work. It's a whole what we call a sort of ecosystem response. But the Child Gauge, which was a report that came out last year on mental health specifically, also noted that maybe one thing that COVID did result in was more of a discussion around mental health. And in that way, that could potentially be one of the positives that came out.
Certainly, like you say, the ecosystem plays a very vital role, from family to the society and even the schooling system, in incorporating systems that can assist these young people. But if we look at children more in the rural areas, do we have adequate resources and access for them to gaining support? And how much of that contributes towards the stigma of going out and actually getting help?
No, you're right. I think there are definitely gaps, particularly in rural areas, where we're not reaching the most vulnerable children. We're not reaching every child as we really need to. And that is obviously a concern. And so we're working with the Department of Social Development, with others, to scale up services, as best we can to reach every child who feels like they need that support. But it also starts, in the home. So working with parents, working on parenting, positive parenting programming, positive disciplinary tactics that parents can use, and doing that on a national level. So really that is an area that we continue to work on to scale up, and is critically important, because we don't want to miss any child who may have mental health issues, wherever they are, rural areas, urban, and it's absolutely vital that we can reach them.
Are we finding that because more and more awareness is being raised now with this generation of young people, we are starting to see quite a big number of them saying, I do have mental health issues, as opposed to maybe children that were born in the 70s and the 80s, where there weren't any platforms for them to be able to express themselves? Do we find that the children of now are experiencing that more, or has it always been they were just not aware of mental health issues amongst young people?
Yeah, I think it's important to realize that those mental health issues, have always been there in society. And there's definitely a more open discussion today than in the past. My parents, who would rarely would talk about such issues. So that conversation's absolutely changed. And it doesn't mean those issues were not there in the past. But it does mean that we can have a better understanding of what the issues are that children and young people are facing, and how can we then respond to tackle those challenges. And that's positive for children and young people, but it's positive for the society as a whole.
Do we find that many of these young children would attribute some of these issues to the parents and the adults in their lives?
Yeah, absolutely. I think in South Africa you have around 60% of children who don't have a father figure, in their lives, in female-headed households. And the father, that's very important. A father figure is very important in child's lives, are positive role models that children really, really need. So we're working on programming. Fathers Matter, for example, was a project with Heartlines that really touched stories, dramas, in their children's lives. That's for any child to have that sort of balance between their parents and the wider family. So absolutely, at the household level is absolutely critical, and that's really the first line of response in many cases.
So lastly, Toby, what are the solutions to manage, prevent and treat anxiety and depression amongst young people? What can we do just as a society, as a first line of defense, before we leave it until it's too late? Yeah,
the first line of defense is really that, first of all, opening up that discussion, not shutting it down. As soon as you shut it down, then children go into themselves and they're not willing to discuss, they're not willing to seek help that they may need. And it's really opening that up so that the right services can then be applied. And that includes, through Childline, for example, 116, where children can access immediate counselling support, safe parks where social workers are on hand to support children from a holistic perspective. But it's not one thing over. Definitely the household level is absolutely vital, as everyone I think knows, but it also goes over to school, to the broader community level, which is why this ecosystem of support is so important.
Most certainly. Thank you so much for that. Very alarming numbers there. Worrying for us as South Africans, but at least we do know, and a stance needs to be taken in stepping up and helping those young people with regards to their mental issues. Thank you so much for joining us on this New Year's Day. That's UNICEF South Africa's Chief of Communications, Mr. Toby Frika, telling us there about the alarming stats of young people seeking help in the past year with regards to their mental health.